Ted, did you ever do anything about your toenail fungus? You said we're going to consult with a podiatrist.
Yes, Sheila, actually I did. I went to a local doctor. He looked at my nails, took a nail sampling which he sent out to a lab and then had me back to go over my options.
Why did the doctor have to take a nail sampling?
Well, apparently there are different types of organisms that cause nails to grow thick and yellow. It is important to know what organism is causing the thickened nails because some of the available treatment options will only work on some of these organisms.
That makes sense. What was the end result?
The fungus that is underneath my nails is one of the two most common forms of fungus. The importance of this is that it makes me a candidate for oral medication, which is one of the treatment options available. It is very important to understand that thick discolored nails are caused by organisms that get themselves underneath the nail. They force the healthy nail off its nail bed, and then the nails become thick and yellow. This is why it is so difficult to clear up nail fungus. This condition is further worsened by the fact that fungus, both skin and nail, thrive in dark, moist environments. So, if you wear closed shoes and socks all day and your feet perspire, it is a perfect growth media for fungus.
What treatment options were you offered greater than?
There are basically 3 options available, all have varying degrees of success. The first is through the use of topical medication. When considering topical medication, it becomes a real commitment on the part of the patient because it requires constant application of medication twice a day. Plus it also requires that the thickened nails also be professionally ground down to reduce the thickness of the nails so that the medicine can better penetrate the nail to get to the nail bed. The problem is that this treatment, although safe, has a very low success rate, as low as 15 to 20%. The doctor also went on to say that most of the medications being sold in drugstores and on the internet are worthless because they are either water-based or alcohol-based compounds. Neither one of them will penetrate nail. Since nail is made up of protein and fat, and since fat is an oil, the topical medication has to be oil-based.
A 15 to 20% success rate does not sound very encouraging. What are the other options?
There is always the option of taking oral medication. The problem here is that the medication only works on the most common forms of fungus. It will not work on the other types of organisms that cause nails to thicken and discolor. There are also potential side effects including problems with the liver and kidney, as well as changes in your blood picture. However, if properly monitored, the medication can be very safe.
How safe is safe?
Well, people on cholesterol medication, diabetics, or people with any history of liver or kidney disease should not take the medication. My doctor does what is known as pulse dosing, meaning, you are on the medication for a period of time, then off it for a period of time, and then back on it. This greatly reduces the amount of medication you end up taking, plus it limits the risks of the medication.
That sounds reasonable. Did you choose the oral medication?
Actually, no. The problem here, aside from potential side effects, is that the success rate is only in the area of 70%. The reason for this is that many nail infections are mixed infections. This means that there are more than one organism causing the nail fungus. So, the oral medication may work well on the more common organism but will do nothing for the other organisms.
Well then, what did you decide to do?
My last option was laser surgery. Laser surgery for nail fungus has been done in Europe for years, but came to the United States a few years ago. Until recently, none of the laser units were FDA cleared for treatment of nail fungus. Last year 2 companies received FDA clearance and so my doctor began doing laser surgery on nails.
That sounds very high-tech. It must have been very expensive.
You are right in that the treatment is not covered by insurance, so you must pay out of your own pocket. Having said that, I thought the fee was reasonable. My doctor does the treatment a little different than most. For one fee, he does 2 treatments, 2 months apart to ensure that all the fungus is killed off. He also performs the procedure on all the nails even if they do not show any visual signs of fungus. Plus he gave me an antifungal solution to apply at night to all the nails and the spaces in between the toes.
Why do you need the procedure done on clear nails and what is the purpose of the antifungal medication?
As my doctor explained to me, My nail condition is basically athlete's foot of the nail. In order to prevent reinfection, which is common with athlete's foot, the doctor attempts to eradicate all fungus and potential areas of fungus by using the laser on all 10 nails. The topical medication is used in an effort to prevent reinfection. He also gave me instructions on what I need to do with my shoes, since I am prone to athlete's foot.
Was there any pain?
The procedure is completely painless. There is no anesthesia required. It took about 20 minutes. I will be going back in 2 months for the second treatment.
Wow, it was that simple. What is the success rate with laser surgery?
According to the doctor, depending on what study you read, the success rate is between 88 and 95% successful. He was quick to point out that preventing reinfection is very important.
You know, Ted, I would be interested in getting more information. How do I go about that?
Sheila, go to the website footspecialist.net. You can then call the office and they will give you more information. Once again, the website is footspecialist.net.